Breast cancer vlog, day 46. 3 days post double mastectomy. And the girls are gone. It's a bit shocking. I finally got a look at the incision last night, and the incision looks good. And I think it looks okay from the front. It looks really gross from the side, but it is what it is. I'm going to do a little show and tell so that you can see. So right now, there's like a 16-inch incision that's covered with tape, and then you can see this is the compression bandage that's just kind of holding everything in place. You can see the remnant of the surgeon marking my skin. And then, of course, we have drains. So let me show you a drain. I've got a drain on the left side and a drain on the right side. Just drained it about an hour ago. So the first morning, I fainted twice with the drains. I just had this wave of nausea, and then I went down, and then they picked me up, and I was down again. My knees just gave out. I haven't fainted since, haven't come close. Oh, but my friends, this is not for the faint of heart. I will confess that I'm a little angry at God right now for making me go through this. You know, you always ask why me? I don't know why. I don't know why. I know that breast cancer is an epidemic across the United States, pretty much, that it's everywhere. A lot of the patients that I've talked with and the doctors that I've talked with, including a big IC specialist in New York, said it's just raging across Long Island. I think we're paying a terrible price for having a lot of toxics in our homes and in our environment. You know, I have a degree in chemistry. I've got 2 degrees in chemistry, actually. And I wouldn't trust a chemistry company as far as I could, or a chemical company as far as I could throw them. Because ultimately, in the end, they're all in it for money, and they don't really care if it's harmful or not. And we've seen that over and over and over again. So anyway, not allowed to get back to work for 4 to 6 weeks, so I've got to occupy myself. I'm still taking a lot of pain meds, so I'm not really up to doing a lot. My head is a little fuzzy. We're gonna do pain meds every 4 hours. I did them 3 hours yesterday, 2 hours the day before. And let's just see if we can reduce the overall pain meds in my body so that I'm not quite feeling it so much. I think I've lost some weight too, but you know what, it is what it is. So that's my story. And if there's one thing I hope that this vlog accomplishes, is that for anybody out there who has any weirdness on their mammograms, for God's sake, get it checked out. And do your self-breast exams. And if you feel anything unusual, go get it checked out. Because literally waiting 6 months could be the difference between stage 0 and stage 2. Hopefully, my lymph nodes come back clean. Surgery will have cured me. And if I want to have reconstructive surgery, I can do that in a year or 2. I have to see. I will admit that I was crying and shocked last night when we took off the bandage, because I got to see my chest in a mirror for the first time flat. The girls are definitely gone. There's sensitivity along, so the incision starts like here. It goes all the way here and here, all the way here. So anyway, go get your mammograms. Nip that sucker in the bud. Because if you wait too long, like literally the first case study I read was of a woman who had opted for reconstruction. And the doctor left a little bit of breast tissue in there to kind of serve as a mount or a platform for the fat that they put in to kind of create the shape of breast. And he left cancer in there. And 3 years later, she was stage 4, terminal. that's why I opted for just take it all. I wanted to reduce that risk. I wanted to not be held prisoner by large painful breasts. And it's going to be an adjustment. There's no doubt about that. But, so what do I remember? So I remember waking up that morning. I was just determined. I remember getting to the hospital to have my radioactive tracer for the lymph nodes so that they could follow the lymph nodes. It was funny is they wouldn't tell me where that injection would be, and it turned out it was in my areola, but it wasn't terrible. It was very quick. And then I remember driving over to the outpatient surgery center. I remember hanging out with my sister a little bit. I remember them taking me back and me changing, and I remember talking with the anesthesiologist, but after that, nothing. I don't remember coming home. I remember nothing. Nothing. One of my big concerns was what it would do to my jaw, since I have really bad TMJ, and my jaw was definitely messed up for a couple of days, but it feels like it's a little bit better now. So anyway, we made it. I'm sure there'll be some tears upcoming and just getting through the shock and trauma of it all. But I just wanted you to know that I'm here, and I want to thank you for all your support. Thank you, thank you, thank you. All right, I'll see you on the other side.